Welcome back to the brand new Pioneers in Aged Care podcast. The guest for this episode is Michael Mouyis, Chief Operating Officer at Infinite Aged Care. The sponsors for this episode are Global Talent Agency and the Seniors Channel. Global Talent Agency are a boutique international talent solutions specialist, connecting great Australian businesses to talent from across the globe. The Seniors Channel is an interactive entertainment and activities platform designed for residents in aged care and seniors living at home. If you haven't done so already, please do click like and subscribe. Until then, let's go. All right, awesome. Welcome to the Pioneers in Aged Care podcast. Here we have Michael Mouyis, COO of Infinite Care.
Thanks, Anthony. It's great to have the opportunity to talk to you today. Thank you very much.
Thank you. Look, as a COO of an aged care organisation with how many facilities?
Yeah, we've got 17 aged care homes across the country.
That's huge. That's a lot. Your schedule is no doubt packed, sure. But I appreciate that when I reached out, you were pretty, very open and pretty prompt in replying, in getting locked in for this session. So I appreciate the enthusiasm.
Thanks. No, it's great. It's great to be here.
So to give the audience a bit of context about as to who you are and how you came to be the COO of Infinite Care and how you got into aged care, let's go through your LinkedIn profile. So you're also a board member, Myrtle Cottage, starting this year. So currently COO Infinite Aged Care from May 2023 to the present. New South Wales Victorian Regional Manager and National Additional Services Manager at Bupa. It's a huge organisation. Prior to that, New South Wales Regional Manager, Regis Aged Care. And then ALH Group, New South Wales Operations Manager. Prior to that, Hotel Assistant Manager, the V Group. So you've been in hospitality for some time. Was the Bupa role your first, the Regis role was your first foray into aged care?
Yeah, that's right.
How was that? How was that transition from ALH Group, hospitality, into aged care, which is heavy in hospitality, but with that additional clinical wrinkle?
Yeah. Look, it was great. It was 6 years ago now, and I'll forever be thankful to Regis. And there was a lady called Michelle Baker and Fiona Charleston that took a chance with me 6 years ago. I think they, it was a bit of a risk. Gentleman, non-clinician, no background in aged care, but look, they're both really progressive leaders, and they saw the synergies between aged care and the hospitality and the hotel services and the customer service and the general management approach, and they recognised that a large organisation like ALH Group had very similar skills and similar focuses. So, whilst there was a bridge to overcome around clinical knowledge, it was certainly something they were willing to take a chance on, and be forever thankful to both Michelle and Fiona and Regis.
Are they still there?
They're great. They both still work in the sector. Okay. Yeah. So Michelle's with Lavande and Fiona's with Bolton Clark. So
nice.
Yeah, both still in the sector.
Well, shout out to them.
Yeah, absolutely. Be always thankful for them.
And was it? Do you feel like you were thrown? I know you were supported, but in terms of being thrown in the deep end, was it a huge, stark difference, or was it mostly translatable? Did you find your feet pretty quickly?
Yeah. Oh, look, a lot of transferable skills. At the end of the day, running an aged care home is very similar to the hotel industry. It's about customer service and about making sure that you're looking after, in our world, our residents and their loved ones. And that's the same as hospitality. When people come into a hotel, it's about making sure they have an amazing experience and it's memorable and they want to keep coming back for it. So the transfer was probably not as hard as I probably anticipated. And to the credit of Regis and a number of their leaders, look, really well-established organisation, great processes, really supportive culture. So that deficiency around clinical governance and oversight, I was able to sort of learn, in my time there, and as the organisation's such a strong organisation, I suppose I was able to add value in areas that perhaps they were looking to develop in, and also develop in areas that I wasn't so strong. So
I love that you were able to speak so positively about them and at length. At no point did you cut your answers short, even though you're the COO of Infinite Aged Care, a competing aged care provider. It really does show that there is a collaborative spirit within Infinite Aged Care. Would that be right?
Yeah, absolutely. Yeah, I mean, Infinite's a fantastic company. I can talk at length about Infinite and will throughout the interview, but I think, as you know, the sector is really collegiate as well, and the more we work together, the better the outcomes at the end of the day. I think most people in aged care are really there not to compete against one another, but to make sure that we deliver great quality care to residents in that final stage of life. So nothing but good things to say about Regis and Bupa, and my time at Infinite's been sensational.
So with Regis and Bupa, you were at the at the state level, looking after the New South Wales state. Going into a COO role at Infinite Aged Care, was that a tough transition? Because I actually don't really know what a COO does. I imagine there's a big overlap between a CEO and a COO, but there's got to be a big jump between your regional role and a chief operations officer.
Yeah. Look, again, I've probably, in hindsight, been really fortunate with some leaders that I've worked with. So our CEO, is Luke Grieve. He's a fantastic leader. So whilst I've had to transition from a regional state-based role into a national COO, it's been fairly seamless through the support of Luke, and we've got a really great executive team at Infinite. A couple of our founding directors are fantastic, and the executive team's been stable. So that's really helped with that transition. But it's been, I suppose, easier said as a result of the environment that I work in.
So tell me about Infinite Aged Care. You said 17 homes. What other services and which locations, which states are you in at the moment?
Yeah, so 17 aged care homes spread from Queensland, New South Wales and into South Australia at the moment. We also have 2 hospital partnerships. So we've got a partnership with Cairns Hospital, and we also have a partnership in South Australia at our Clemsig home. So we provide subacute services out of our Clemsig home.
Oh, okay. So you've got homes there, but then the hospital can use the facility.
Yeah, correct. So we look after 17 hospital patients in our Clemsig home as a dedicated wing, and we provide all care and services for those residents, and the medical services are provided by the hospital, so the GPs and...
There's that collaboration I was talking about, and that's one of the questions I used to ask in previous podcasts. I'd get the guests to ask the next guest a question. And one of the questions was, how are we going to work with hospitals, and how are hospitals going to work? Like, how do we break down that barrier between you either work in a hospital or you work in aged care, but it sounds like you figured that out.
Yeah, look, and it's been a great relationship for us for many reasons, but to your point as well, just about the sector, we know that the hospital system's struggling at times with capacity. So, if we can relieve some of that pressure from them, it's a better outcome for society in general. So we're able to, in that instance, provide care for 17 residents that would have normally taken up a hospital bed, and potentially limited access for people that were in desperate need of care. So it's a great outcome for the hospital, and for us, it gives our staff the opportunity to work really closely with geriatricians and doctors and social workers that they perhaps wouldn't have had the opportunity in a traditional aged care environment.
And what were the states you mentioned again where you have a presence?
Yeah, so we're in Queensland, New South Wales and South Australia, and we've got 2 homes currently being built in Victoria, which will open between September and November of this year.
Oh, nice.
Yeah.
When are you coming to WA?
That's a good question. Probably no imminent plans to head into WA. Where we've got established homes, we'll continue to look to build and acquire, but who knows? And
home care, retirement, are these already in the works or plans?
Yeah, so currently purely focused on residential care. It's our, I suppose, our core business, and that's where we feel we can deliver the best outcomes. But Infinite Care is a really expansive company and looking to continue to grow. So I would say home care and or retirement village or both, is definitely possible in the not too distant future.
And if I was to talk to one of your employees and I asked them, what do you guys love about working for Infinite Care? What are the benefits of working for Infinite Aged Care?
Yeah, good question. Look, probably two things come to mind for me. So we've worked really hard in the last few years around stabilisation of senior leadership roles. We've had no change in our executive roles in the last 2 years. Our regional operations roles haven't changed in the last 2 years, and our general managers, we've got really strong general managers. So, as a flow-on effect from a staff member's perspective, there's consistency in what we're trying to achieve every day. There's alignment between the board and the staff members. So I think, from a frontline staff member's perspective, you're not getting inconsistency. You're not turning up one day and, we're trying to go in direction A and then the next day we're going in B and then another day we're going in C. So I think consistency is critical for a staff. And probably the other one that springs to mind is, we're always trying to challenge the status quo. So, be that technology, be that partnerships with hospitals, be that our model of care, we're always looking to continuously improve. We sort of think to ourselves that if we can always be better tomorrow than we are today, we'll be making a big difference.
What technology interests you at the moment, aged care related?
Yeah, look, I think it's an exciting time from a tech perspective. It'd be silly not to say AI is going to make a big difference in our sector. And one of the things that I suppose we're quite proud of is our investment already in AI. We've got a tool that we call Abby. And what that does is that helps scan progress notes and incident reports and charts and helps our clinicians identify any changes in resident care needs on a daily basis. It's refreshed multiple times a day, and that helps us just detect where there's any changes.
That's amazing. You developed that in-house?
Yeah, we've got a developer that works closely with us, and he's partnered with a number of our senior clinicians to obviously refine that. But yeah, it's making a big difference.
Yeah. So all your clinicians, your carers, everyone writes their inputs their progress notes.
Yeah.
This software runs in the background and tracks the trends.
Yeah, spot on. That's right. Yeah. And then it can help us detect, perhaps earlier than we would have through human intelligence if there's any changes. Which
that would save a lot of manpower. All those hours pouring through the notes to track and chart.
Correct. Yeah, and I think it's really pointing our time and effort in the things that are going to make the biggest difference for residents. At the end of the day, I think we all recognise that progress notes are important and being across those are critical. But if we can save the time reading those or reading charts and provide a summary of those changes so that our staff can provide more care to our residents in a face-to-face environment, that's a great outcome.
I love that. What's keeping you up at night at the moment? What issues are giving you a headache?
No, I don't think anything's keeping me up at night at the moment, to be honest. Yeah. I mean, the sector's full of reform, and there's obviously a lot of change, but that's a mindset as to whether that keeps you up at night or not. I think it's an awesome time to be in the sector. We've just finished our leadership forum up in Queensland, where we had all of our our senior leaders across our homes and our support officers come together, and that was great. 55, 60 of our most senior leaders all in one space. And it's great to reflect on where the sector's been. We've gone through a lot of hard times, be it royal commissions, be it COVID, be it challenges in occupancy. But if I look into the forward-facing window, I can see nothing but great opportunities for us. I think the Fair Work case increases is great for our staff. I think stabilisation in funding has been that will help the development of the sector. I think it's a great time.
Yeah.
So nothing's keeping me up at night.
No. Okay, so what's on for the next 12 months? You've implemented Abby. That's an awesome innovation.
Yeah.
There could be smaller little goals. I'm just keen to hear what's in the pipeline.
Yeah, sure. Look, so probably a few things that are priorities for us will be our acquisitions and growth strategy. So we've got 2 homes that will open in Melbourne in the next 6 months. So they're obviously going to take a lot of time and effort to make sure they're successful, and we'll continue to look to acquire in Melbourne and in other states where we operate. So That's definitely going to take part of our focus. Look, operationally, our model of care rolled out in December of last year, so we're still in the process of embedding that across our homes, and also starting to track and measure some of the results that come from that. So yeah, from my operations lens, those are probably a couple of the big ticket items we're working on.
Nice. All right, I've got some questions from our sponsors today.
Shoot.
And I'll play the video.
Hi Michael, I'm Thapa from Global Talent Agency here. I've got a question I'd love to ask you. In light of the ongoing workforce challenges across the aged care sector, what are your own experiences and considerations when exploring international recruitment as a means of addressing those shortages? I'd love to hear some of your wins and some of the learnings that's come out of it. Thank you, Michael. Have a great day.
Yeah, look, great question, and thanks for sponsoring the show and supporting the industry firstly. Look, absolutely, workforce is going to be one of the, or has been and will continue to be one of the big challenges the sector faces. And international strategy is critical to addressing that, and we've got a number of international pipelines that we use at Infinite Care. I guess some of the lessons and focuses that we have taken on is we're really big not just about the recruitment of those registered nurses. It's not just about filling a role and filling a position. It's really about the assimilation into Infinite Care and also into the country. So we've worked really hard around getting the interview right. That's sort of stage 1, but stage 2 and 3 is the onboarding and the induction for an international RN has to be different to a domestic RN. Typically we find really strong clinicians from overseas, but may not be familiar with the Australian aged care standards or expectations of elderly Australian residents. So a lot of focus around that onboarding is critical. And then probably the third piece that I'd say for us is that assimilation into the community. It's exceptionally hard to become a migrant into the country. Australia's a beautiful country, but when you either migrate with your family or leave them behind, those are big decisions that people make in life. So we can't expect people to have such a significant change in life and then just leave them to find their own way to get a Medicare card and a driver's license and kids in school. So
Yes.
we work really hard to make sure that assimilation is a positive one, and we try to, where possible, get them into a community with other individuals who've gone through the same circumstances and really help set up some of those, I suppose, fundamentals, like I said, a driver's license, a Medicare card, and getting yourself established.
So yeah, that is a key consideration, coming from their own culture, not understand the Australian culture, but typically when they come to Australia, they're in a regional, so they're in they don't get, it's different areas of Australia, so assimilating them not just into Australia, but into the nuances of that town.
Correct.
How do you, what does the onboarding look like? Are they appointed, I don't know what the term, a liaison to educate them, to walk them through?
Yeah.
How does that?
Yeah, there's probably a couple of key things that we try to do in that space. So one is we've got a great team member in our people and culture team that helps support with that onboarding. She's become a real specialist in terms of bringing international RNs into the country and has obviously learnt what are the challenges and what are the areas that she can help with. So she's really made that process a lot easier, and that includes, as I said, things like Medicare cards, to finding accommodation, to being able to get rent, when you don't have any prior history in Australia. So she does a fantastic job, and in credit to our people and culture team in that space. And then the second part is really about trying to assimilate the individual into the community. So for us, we work really closely in finding out what their likes, preferences, needs are. A lot of our international RNs have specific cultural backgrounds, and we can try to assimilate those individuals with others in the area, and that may mean attending church services together. That may mean having kids in the same school. So a number of ways to try to just integrate them into the community, and we've got some really beautiful success stories. I think of my time up in Cairns recently, and there's some beautiful family networks that have come together, and you can just see the happiness and I think to myself, gosh, it must have been a massive decision to migrate out of your home country where you've got family, you've got established bases to come to Australia. That's a huge decision. So it's really rewarding to see them
It's
succeed.
great that you provide that support, because I can imagine it's probably easier for the employee, the person that you are employing into your team, because they'll come, they've got their direction, they'll just go into work and they've got that immediate support, whereas the family and the kids is a whole new world, and sometimes they'll be left to their own devices. They have to navigate it all themselves, and that can be scary.
Absolutely.
So it's great that you have that support system there.
Yeah, thanks.
Let's go to the next question from the next sponsor.
Hi Michael, it's Julie from the Seniors channel here. We've been connected for so long on LinkedIn, I can't believe we haven't met yet. So I'm really glad to be connecting with you today on the Pioneers in Aged Care podcast. My question is around the new strengths and standards, and in particular Standard 7. So Standard 7, as you know, is all about fostering a sense of community and social engagement. How do you think that's going to work with residents who choose to stay in their rooms? I'd love to know your answer, and I'd love to connect with you in person someday soon.
Yeah, great. Firstly, thanks.
Tricky one, right?
Yeah, it's a tricky one. It's a great question, and thanks, Julie. Have been a long time on LinkedIn together and look forward to meeting in person. I think to answer that question, that's a very vulnerable population in aged care, and I think providers need to be really deliberate in the way they operate their homes to make sure that residents that either have the mobility, cognitive challenges, mobility issues, and or choose to stay in their room, they don't miss out on the same opportunities that others gain. So I think providers need to be really deliberate in the way that they provide care. And look, Infinite's done a lot of really great things in terms of our model of care to make sure that we meet those needs. So to answer Julie's question, I think that engagement in the community is it's probably about how do you shift the mindset there, that it's not necessarily about getting out into the community bit, but what activities and what initiatives can you do to bring the community to the individual? So, I guess to share some examples with you, Infinite Care introduced a physiotherapy program about 12 to 18 months ago now, and really proud to say this year we'll deliver 10,000 physiotherapy sessions to our residents in 2025. So we're able to bring people out from the community, such as physiotherapists, and deliver really tailored physiotherapy sessions to our residents. And we're seeing some, amazing results of people being able to go out for Christmas that have never been able to do so before, people being able to walk that have never been able to do so before, people that are in far less pain than they've ever been in before. So some really great initiatives. And probably the other one I'd say is we've deliberately focused on having a one-on-one care companion role as part of our model of care. So what that means is, I suppose we're using the mandated care minutes in a particular way to ensure that our residents, and in this instance, our residents that are most at risk of social isolation, not only are their physical care needs met, but their social and emotional needs are met. So our one-on-one care companions are visiting our residents that are at risk of social isolation, and they're providing a tailored care companion visit to that individual to make sure that their needs are met. Yeah, and we'll provide, in similar sort of numbers, we'll provide 90,000 care companion sessions this year across our homes. So we're really focused on reducing and hopefully preventing social isolation and loneliness in aged care.
And these care companions, do they have a clinical background?
Yeah,
to meet the minutes.
Typically a personal care worker,
Okay.
but someone that has that real passion and care for understanding the residents, and a lot of that their time can be doing things such as writing cards to grandkids, can have Skype videos with families. It might include a walk into the gardens or even out of the care home. So it's really tailored around whatever the resident's looking for.
90,000 care sessions, and then 10,000 allied or physio sessions.
Yeah, so across those two, we'll deliver 100,000 sessions this year.
That's a huge investment.
Yeah, it is. But look, the results are are heartwarming. You know, when you hear that residents are able to go out for Christmas, that we're never able to do that before, you think, you know, that's the purpose of working in aged care.
Well, you've touched on something that is close to my heart, like reablement is a huge thing. It's been a huge thing for a while, but it's the term reablement has really stuck in my consciousness this year.
Yeah.
And I knew the importance of physiotherapy in helping someone regain their independence, because I had chronic back pain myself from 2009 to 2016, 2017. Wow. And I remember thinking, even tying my shoelace or being afraid to sneeze or cough, or going home from work and lying on the floor for 2 hours just to relieve the pressure. And I thought that would be my life going forward. And I'm 40 now, so this was, like a long time ago. But thankfully I found a physiotherapist, because I was recruiting physios at the time, to resolve my issues. So my quality of life, I can play with my kids now, I can be active, I can play basketball, I can tie my shoelace, I don't have to be scared of laughing too hard, I can enjoy the best parts of life. And to have residents get their independence and joy back, it's super important. So reablement, I'm a huge advocate for reablement. So you providing those 10,000 sessions, and it's going to have a huge trickle-down effect. It'll alleviate the pressures to your own staff.
Absolutely.
Because the whole thing is doing with rather than doing for, right?
Yep.
So
Spot on.
That's awesome.
Yep. Thank you. Yeah, and that's something we're really proud of.
What else do you see? So, okay, when you hear someone say aged care isn't sexy, what do you think of? What do you think when you hear that?
Yeah. Oh, look, I think that's a mindset, isn't it? You know, it's aged care is whatever you want it to be. So, you know, as I said, we've got physios coming into our homes that are, you know, doing amazing things with our residents. We've got care companion visits that are, you know, providing people with social and emotional connections that they, you know, would never have before. You know, we're making massive difference in residents' lives, being able to get people to go out to Christmas with their families, being able to get people to walk again, you know, lifting people's happiness in aged care. You know, that's
sexy.
Yeah, I think, you know, it's absolutely, it's up to the provider. You know, I think you know, one of the good things about mandated care minutes is it's allowed providers the opportunity to really have tailored models of care that are going to deliver amazing outcomes. I think, you know, the sector for a long time has run on, you know, quite lean staffing levels, you know, and whether you like or dislike mandated care minutes, it does present providers with an opportunity to have deliberate staffing levels and in the right areas that are going to deliver good outcomes for residents, deliver good outcomes for staff. So, yeah, again, I think if you go back to the purpose, I think 99% of people in aged care are there to make a difference. So, yeah,
well, everything you're doing is bringing sexy back to aged care. Who else? What else are you seeing out there that is going to bring sexy back to aged care? What are you liking out there?
Yeah. Oh, look, there's lots of good things out there. I think you know, a couple that probably spring to mind with that question would be, I really like TLC's integrated healthcare model. I think you know, they do some really good things, not just about aged care, but, you know, with integration with doctors and day respites and day surgeries. You know, I think they've got a really great model. So I've always thought, yep, they're doing some great things down.
I've got to look into that. This is
predominantly down
question.
in Melbourne. So yeah, worth looking into. I think they do.
Is it Lou, the CEO?
Correct.
I've heard of him. Everyone says great things about him.
Good.
I've got to reach out to him then.
Fantastic.
And learn more about that.
I think they do well. And look, I was really impressed with your podcast with Steve from Apollo the other day. I hadn't really understood Apollo's you know, business model and thought process, and I thought it was great just to hear, you know, a different model out there. Great to hear that he's particularly supporting those regional and remote homes. You know, they are genuinely at risk of not being able to survive the reform. So it's fantastic to hear people like Steve and Apollo that are, you know, protecting those homes for the future.
Absolutely. Before we go into you as a person, and so people can connect with you on a personal level, because you've got the title, huge organisation. I can even sometimes be intimidated by people with titles, and I feel a bit of fear in approaching someone just to talk to them because they're busy. I don't want to impose myself on them.
Yeah.
But if I knew you played basketball, I'd just come up and say, hey, what about those Warriors? Or so before we jump into your personal story, so people can pull at those threads to connect with you.
Sure.
Is there anything about aged care and infinite care that we haven't covered yet that you wanted to share?
Oh, look, no, I mean, like my time with Regis, I'm incredibly thankful of Infinite Care. They're a great organisation. Thoroughly enjoyed the last couple of years there, and look forward to enjoying many more. It's led by a great CEO in Luke and our two founding managing directors. So, yeah, it's terrific to work for a company that's got a values alignment and is always looking to improve. So
fantastic.
Yeah.
Okay, so where are we finding you on the weekend? Like put work away, family away. Obviously, the priorities, family.
Yeah.
And then work. But when you've got this, say, days of free time where everyone else is occupied, what are you doing to occupy yourself?
Yeah, not basketball, sadly. Bit short. I think I'm 5'9", so never quite tall enough for basketball. But look, really passionate about soccer. I still play soccer. It's a bit of a passion when I was growing up, and still lucky enough to play. It's a bit of a
avoided all the injuries so far, the main ones, the ACLs. And...
avoided all the main injuries. So been pretty lucky from that front. Yes, I still enjoy catching up with mates and playing soccer on the weekend. But I've got an amazing wife, Amelia, and I've got three beautiful young kids. We've got a 5-year-old boy, a 2-year-old boy, and a 1-year-old girl. So that that keeps me pretty busy on weekends. So typically you'd find me probably either playing soccer or attending
wrestling the kids.
The multitude of activities that kids go to.
Amazing. I can't imagine, like, when I had one kid, I thought, okay, our world has changed. We've got someone to take care of now, and I thought that was hard. Yeah. Now we've got two kids, a 5-year-old and
congratulations.
Almost 5.5 and almost 4. Okay. And so that again flipped our world upside down. And every time one is sleeping, and we just have to entertain the other. Piece of cake. I can't imagine so with 3, because you can't just do one takes that one takes this one, now there's a third one running around. And as the COO of a large aged care organisation, that's a tough juggle. Sure. So I can.
I look again. I think it's a bit of a mindset, though, isn't it? I'm incredibly blessed to have 3 healthy kids and a beautiful wife and a great job. So
where did your this mindset? Because you mentioned it a few times now, and you're absolutely right, and it's not something that I know I need to be more active in setting my mindset each day, but I've just been reactive, just taking it as it comes. Yeah. Where did that come about?
Oh, look, I think, again, to Infinite's credit, and Beck Pace is our Chief of People. We've got a great program with Apollon. I think that was mentioned in a prior. And that's all about learned helpfulness versus hopefulness. And I think in a sector like aged care, where it has gone through a lot of change, you do need to be resilient. It's really critical for leaders to take a positive mindset. I always think to myself, even if I've had a bad day, I am in such a fortunate position to live in Australia, to have 3 beautiful kids, to have an amazing job. So, realistically, my bad day is probably pretty amazing comparatively to others. So,
you've got your health. I think, and every time I complain about something, I do try to remember the saying that an unhealthy person only has one wish, right? Yeah. Okay. So I try to keep that in perspective. As long as we've got our health, we've got our family's health, everything else can be tackled.
Couldn't agree more.
Awesome. Thank you so much, Michael. Really appreciate having you on.
Thank you. It's been a pleasure. Thank you for the opportunity.
No worries at all.
Good one.
Thanks, guys.